definitely this is the a very important question because the cardiac problems are more dramatic. So you have heart attacks, you have ICUs, you have collapses, and you have all the emergencies there at the cardiac. So the patient fears what he feels mainly. So the problem is that diabetes, they won't feel it. It is like painless problem. So it kills them slowly. So but cardiac problems, what happens with cardiac problems is they have a immediate effects like there are some emergencies with pain including with it, so that the patient fear more of cardiac problems, but the silent killer is the diabetes. So they should know that the reason for the cardiac problem is diabetes, and if their diabetes was under control, this cardiac acute event might have been prevented also. So that means that they fear more to the acute events than a silent event.
Many of the patients will be having poorly controlled diabetes in an Indian population. So high blood glucose levels lead to majority kidney problems, retinopathy, and also neuropathy, which is related to they complain of burning sensation in their feet, and this lead to decreased sensation in the foot, which can cause foot ulcers, which is a major problem in our population because we are farm workers with us, and also most of the patients are under they do not have any access to foot care, so they will be having certain foot ulcers which are unrecognized, which lead to blood infection, sepsis, and it can cause multi-organ dysfunction, and this can lead to death of the patient. As Dr. Rammohan sir has also told, so acute events like cardiac diseases and also cerebrovascular strokes can also occur in diabetic mellitus patients, which can further lead to their decreased quality of life, and also for increased clinical visits to the hospital, which and also increases the economic burden of the patient also.
Diabetes directly affects heart because uncontrolled prolonged blood sugars leads to blockage of the blood vessels in the heart. That leads to various cardiac manifestations including coronary artery disease, heart failure, even silent heart failures can also be seen in diabetics. So along with uncontrolled blood sugars, other comorbid conditions like hypertension, increased cholesterol levels, smoking particularly, and poor lifestyle, that is not following proper diet, and bad habits like smoking, alcoholism, and unable to be active, that is active life is not present in most of the professionals. So ignoring the lifestyle changes along with uncontrolled blood sugars, other all risk factors will have major effects on the heart. So nowadays we are seeing even young onset cardiac problems also. People in 30s and 40s are also presenting with heart attacks because diabetes onset itself has changed. Previously we used to see diabetes in 50s and 60s. Nowadays 30s and 40s is becoming the age of onset of diabetes. So diabetes is one of the major risk factor for cardiac problems. So it affects heart in various ways. So we screen for the cardiac problems even at the onset of diabetes itself. So along with good control of blood sugars, we have to take care of other comorbid problems like hypertension, cholesterol, lifestyle measures, quitting habits, bad habits, everything needs to be taken care of to prevent long-term cardiac problems. And we do screen for cardiac issues annually in all the diabetic patients from the onset of diabetes itself. So diabetes is one of the prominent reason for heart attacks in Indian scenario especially.
In fact, that's a major myth that actually is very common in people with diabetes. Because if you start from the diagnosis of diabetes, type 2 diabetes, typically the ones we see in our community, most of them are in fact detected by screening. That means they are asymptomatic. People without symptoms, they get their blood test done and they're found to have diabetes. So you just don't need to have any symptoms to have type 2 diabetes. Because type 2 diabetes by itself is defined not in terms of symptoms. It's defined in terms of the levels of blood glucose. You could have very high blood glucose levels and have some symptoms like polyuria, that means excess of urination or weight loss and things like that. And you could also have, say, sugars which are normal means slightly higher than normal and having no symptoms at all. So you cannot rely on symptoms for the diagnosis. And people tend to report symptoms very variably. Some people, even with a slightly higher blood glucose, start saying that they are having symptoms. Some people with very high blood glucose are totally asymptomatic. So that's a myth that you should be having symptoms to have type 2 diabetes. You could have no symptoms and still have high blood glucose. So that is a myth which should be, in fact, be busted.
We know that people come to us in our OPD and tell us, doctor, I am not taking any sugar. Still, I don't have, I got diabetes. Why did I get diabetes? And another thing also, that people might tell us that since childhood, this person is always fond of sugar, and that's why the person got diabetes. So these two problems always, or these two common statements come in our OPD every day. We hear so many people saying this. It's completely false. We know that just by taking more of sugar does not lead to diabetes as such. There are multiple other factors. Most important is genetics. I always tell them to my patients that unless you have the genetic lottery of diabetes from your forefathers, it's very unlikely that just with eating too much of sugar will cause you diabetes. So that is one major myth we have to bust, most importantly, because that's a dangerous one too, because people tend to stop eating sugar and feel that they have done much and their diabetes will get controlled. And it's also a major stigma to the population, because people tend to attribute their diabetes to high sugar intake and always blame even their family members for taking more sugar and getting diabetes. So it's a very important myth to be completely busted.
So insulin is basically a natural hormone which is produced in our body, and it takes care of blood glucose levels in the body. So people with type 2 diabetes, they need to understand there is a insulin deficiency also they have, and their insulin, whatever is produced, is also not acting in a proper way. That means they have insulin resistance as well. So if someone is requiring insulin, they need to understand that it eventually, even the tablets, how they work, they either stimulate the insulin secretion in your body or they break the insulin resistance. Ultimately, it's the insulin which is controlling the blood glucose levels. So insulin may be required in two situations. Sometimes we give insulin temporarily to people who are admitted for surgery or having infections or admitted in the hospital, and in those situations, in fact, insulin is very useful to take care of that short stressful situation, and we are able to wean them off the insulin also, even given for a short period of time. But at the same time, there are people who have long-standing diabetes, or maybe they have a different kind of a diabetes. There are lean type 2 diabetes in which insulin production is not much. So they need to understand that their body is not producing enough insulin, and we just need to give insulin from outside because body is not producing. It doesn't mean that their diabetes had worsened so much or it's a last resort. In fact, if started at the right time, we can prevent complications. So if we educate patients properly, and if they understand the insulin action, and also at the same time insulin dose adjustments, regular monitoring, then that fear usually goes away. But this is completely a myth that this is the last resort or it will worsen the situation.
So there are two components to diabetes management. One is prevention of long-term complications, and the other is day-to-day quality of life. Now, when we talk of prevention of complications, there is an age-old triad that we follow. The numbers themselves, the blood glucose numbers, the HbA1c, that is A, then blood pressure, that is B, and cholesterol, that is C. Why all three are important? Because if you're looking at preventing heart disease, kidney disease, eye disease, nerve problems that happen because of diabetes, you cannot do it by just blood glucose control. So diabetes is more than blood glucose. You have to, at the same time, with the A, that is A1C, control the B, that is blood pressure, and C, that is cholesterol. So that's the basic sort of tenet of preventing long-term complications of diabetes. But it's much more than that. You also have to ensure that people's day-to-day lives are managed well. And even to achieve this ABC target, you need really good management of diet. We need regular physical activity or exercise. And we need good emotional and mental health. So these days, management of diabetes is about organ protection, about long-term effects, but it's also equally about removing the stigma, having people live comfortably, having people carry on their jobs comfortably, carry on their family life comfortably on a day-to-day basis. So if you put standards there which are not pragmatic, not attainable, and make the person feel very different in many ways, you're setting up different kind of challenge. So broadly, these are the two silos in which I would keep holistic management of diabetes.
The diabetes management rests on three pillars actually. It's the diet, exercise, and the mental health. So coming to the first pillar, that is the diet. Basically, we require some nutrients which we require to the most, that is carbohydrate, protein, fat. We call it as macronutrients. And there are some smaller quantities of nutrients like micronutrients. But macronutrients has to be divided in a proper manner. That's what you asked for, a proper plate in that. So scientifically, we tell that 50 to 55% should come from carbs, and that should be complex carbohydrate. The 20 to 25% should come from protein, and fat content should be less than 30% in our diet. In that fat portion, at least less than 10% should be saturated fat. So saturated fat is basically any fat which solidifies in the room air. So that's the gross thing which you remember. And trans fat, that is the fat which is burnt or cooked more number of time, that should be the minimal, or it should not be there in our plate actually. So that is from a scientific point of view. But what do we tell to our patient, because they cannot understand how they should divide the carb, protein and fat? So we tell them that you take a plate and half of that should be vegetables and fruits, so green leafy vegetables and fruits. So remember that fruits and vegetables contains not only carbs, they're complex carbs, and also with good amount of fiber. So, and we tell that it should be of variety of colors, like you take apple, orange, papaya, guava, all have different colors, the spinach and all, so all have different colors. So half of your plate should have colorful fruits and vegetables. Then out of the rest of that half, 1/4 should contain the cereals or more complex carbohydrates and cereals and pulses like that. Then the rest 1/4 should contain protein. So protein is very, very important, especially from Indian point of view, where we mostly take carbs and we forget the protein. But 1/4 of our plate should have good amount of protein that contains, for non-vegetarian food, it may be egg white or lean meat or maybe fish, or for vegetarians it might be paneer or tofu, or even the pulses also, they contain good amount of protein. So that's how a plate should look like. But more than plate, now the concept is that it is the portion size or the size of the plate. So that should also be smaller, rather than taking a big plate and then you divide among them. That increases the calories actually. So these are some of the practical tips we tell to our patients.
Oh yes, the answer is big yes. In today's age and stage, I wouldn't see anybody who's not suffering from stress, whether it's a school-going child or a college-going student or anybody working. I think stress is everywhere. But yes, it does impact blood glucose values. Technically speaking, there are certain hormones in the blood like cortisol, like methanephrine. These are the stress hormones. These go up when you are stressed out. And then these hormones are capable of increasing blood glucose quite significantly. Stress indeed also leads on to poor sleep, poor quality of sleep, poor duration of sleep. That also has a direct impact on blood glucose values, not only glucose, but even blood pressure and a lot of other metabolic changes which are not good for your body. But I would say the main reason how stress leads up to high glucose, and even weight for that matter, is that many times people who are under stress start eating more. Food is one of the best antidepressants which is there, and a lot of stress eating happens. They don't even realize that they're eating a lot, and they're just trying to combat their stress and finding that relaxation while eating. And that is something which can really spike blood glucose and weight levels. So yes, stress can affect blood glucose values in several ways, as I described, and this is something which needs to be addressed by your treating physician.
Families are extremely helpful, and they can be partner, not supervisors. For example, they might remind them of making the log, but they should do it very carefully. There should be sensitivity and respect in that. Instead of asking, many times people ask, have you checked your blood sugar? It can be better that, can I help you to check the blood sugar, or let me know what I can do help with that, or let me see how the sugars are going. Let's see it together and then decide what steps should be taken. So family members can also learn to interpret this trend, what are the high sugars and the low sugar, and explain that calmly to the patient. And they can be an important bridge between the patient and the doctor, who can say, doctor, this is what I have observed. The idea is to empower the patient, not to pressurize them. So when families show empathy, and if suppose they respect and give their space to the patient, that's when patient feels supported, and they are more likely to stay consistent with the self-monitoring of blood glucose.
I guess they can be more supportive and not controlling. So they should not be like they are policing. You should not say that you should not eat that. You can always say that, would you like me to help you with a lower carb version? That is something that is collaboration, not correction. Now, don't talk about diabetes when the patient has a high glucose reading. Patient is already stressed at that moment. Let the patient calm down, and you can always talk to the patient about the high glucose levels. When the patient is in a better condition, the glucose levels have gone down. Diabetes can be emotionally draining, so you have to provide emotional support also, and let the patient talk to you about his or her feelings. Emphasize being that you are on the same team as the patient, that you want to feel energetic with the patient, and make small achievable goals together, like walking for 1 kilometer, 2 kilometers to start with, then going on to 3 and 4 kilometers. There should be no guilt or blame, so no moral judgment on the food choices. And tell the patient that blood glucose levels are just numbers. They are not grading you on the level of glucose levels, and they will get better if they work together. The patient and the family, they work together. That's going to make a lot of difference. Attending educational sessions together, addressing concerns together, I guess that makes more sense. And let the patient be autonomous in some places. If the patient does not want you to know the blood glucose level, let the patient keep the record with himself or herself, and the patient can disclose it to the doctor. So don't respect the autonomy of the patient. Don't police the patient. I guess that is the most important thing that you can do for your patients.